So, today I want to talk about the rules that were established last week by the CDC about fully vaccinated people and masks. So, I've been seeing a lot of conflicting reports in the media about all of this. And given that I recently just got my second dose of vaccine and soon will be considered fully vaccinated, I thought we could jump right in and look at what the CDC has come out and said and go over all this information that is now circulating. So the CDC has listed on their website as of May 16th, 2021, if you are fully vaccinated, you can resume activities that you did prior to the pandemic. Fully vaccinated people can resume activities without wearing a mask or physically distancing. Now, this sounds promising, but some questions automatically pop up into my mind upon reading this. What made them make this decision, for example? Now, to be fully vaccinated, just so we're all clear about our terminology, someone is considered fully vaccinated either 2 weeks after the second dose of either the Pfizer or Moderna series, or 2 weeks after the single dose Johnson & Johnson vaccine in the United States. And again, you can resume activities as they were prior to the pandemic. And if you travel, you do not need to get tested or self quarantine after you arrive in your destination. However, if you've been fully vaccinated, the CDC does advise that you still need to follow the guidance of your workplace and local businesses. If you travel, you should take steps to protect yourself and others, and you'll still be required to wear a mask on things like planes, buses, trains, and other forms of public transit into, within, or out of the United States. And you should still watch out for COVID symptoms, and you should watch out if you've been around somebody who has definitely been sick. And people who have a condition or are taking medications that weaken the immune system should talk to their healthcare provider to discuss their activities. They may need to keep taking all precautions to prevent COVID-19. So that's the information that we more or less get from the CDC. Now, all of this raises a number of questions, especially given that the policy shift occurred abruptly and went against all previous claims by the CDC. These questions include: first, what research or evidence prompted this change in policy, and what does this research and policy tell us? Second, what does this research tell us about wearing masks and social distancing and all the other forms of protection that are available, and how it compares to the vaccine itself? Three, what does this all tell us about the mutations or variants of the virus that could possibly form or already have formed? Four, I'd want to know, what does this mean for the immunocompromised people in our lives when the CDC itself acknowledges the effects are unknown and that people should talk to their doctors about it? If you're living with someone who's immunocompromised, at what level of immunocompromisation are we talking about in terms of this not being effective? Is this being addressed at all? Five, given that we have no accurate way of addressing who has and who has not been vaccinated, are there guidelines or ways in which we can figure out who may or may not be safe to be around without a mask? Especially since you can theoretically lie about, not having a mask, and not needing a mask because you could say you're fully vaccinated. And is there a consensus amongst medical professionals to affirm these new guidelines? And so these are some of the questions that I thought of. I'm sure there's more out there, but I wanted to address these because these are the ones that popped into my head first. So, according to both CNBC and People's Magazine, there are 4 studies that were used by the CDC to make this new determination. So, I want to take some time to look at these 4 studies that were cited as causing the CDC to change its mind to see what new research and what information this reveals to us about masks and other forms of protection for vaccinated people, and just kind of go over all of that data very quickly. Now, I obviously don't have the full reports because some of them are not really available. Some of them are, and I've read through or skimmed through most of it, but most of the conclusions provide the relevant information. The first one was an association between vaccination and the incidence of symptomatic and asymptomatic SARS-CoV-2 infections among healthcare workers. Now, this study was done in Tel Aviv, Israel, And among healthcare workers at a single center in Tel Aviv, the recipient of the vaccine compared with no vaccine was associated with a significantly lower incidence of symptomatic and asymptomatic infection more than 7 days after the second dose. Findings are limited by the observational design. Now, the first thing that pops up when I look through all of this study is that there's no mention of people not wearing masks or not social distancing. As a matter of fact, healthcare workers would probably be a population that would have both the vaccine, would continue to take other safety precautions like masking and social distancing while they are in their workplace as much as possible. Meaning that this does not provide any sort of control to say it's safe to, avoid wearing a mask or to not socially distance. So I figured one of the other results must have told us more information, that this one was just about the effectiveness of the vaccine. However, when we look at the other studies, we find that the second study that the CDC put out in its Morbidity and Mortality Weekly reports dealt with infection among healthcare personnel, first responders, other essential and frontline workers, all people who are more or less going to try to social distance and wear masks. Meaning that even though these results do confirm that the vaccines are highly effective, they do not display whether that effectiveness is enhanced by masks or social distancing. When we move on to the third discussion and report, we end up dealing with those who are hospitalized adults over the age of 65. So I thought maybe there was some sort of control group presented here. And what we found from this report was that in a multi-state network of U.S. hospitals, the biotech and Pfizer and Moderna vaccines were 94% effective against COVID-19 hospitalization among fully vaccinated adults and 64% effective amongst partially vaccinated adults age 65 and over. Now, the thing that bothered me about all of this is the only mentioning of masks that even comes up in this entire study is that it is a continued risk for at least 14 days after receiving the second dose of either Moderna or Pfizer, which is information that we've already been aware of given the definition of fully vaccinated. So they recommend that people at least wear their masks for that long. So we bring ourselves to the final study, and this one only talks about 2 different variants and mutations of the virus. And in these 2 variants, we found that one is 89%, the vaccine is 89% effective against one variant and 75% against the other. However, the vaccine effectiveness against severe, critical, or fatal disease due to infection with any of these variants was very high at 97.4%. So, with all of that, and in summary of all of that, these articles do not provide any sort of control to determine that masks are not necessary for fully vaccinated people and that social distancing shouldn't be continued to be practiced. While it is great to know that these vaccines are indeed effective and do improve safety, especially in places where there's a large grouping of people, it could easily be the combination of masks and vaccines that provide such effective results, even when compared to vaccines alone. But we have not tested any of that. There's no control presented in any of these studies. And while we have, again, positive information that the vaccine is fairly effective, at least in terms of symptoms and keeping symptoms in a safe range, on 2 of the mutations, this also doesn't extend on to other mutations or to any other possible future variants that might form due to the virus continuing to spread at really high rates. Further, these results have provided no information or safety or comfort for anybody who's immunocompromised or has immunocompromised people in their family. And the decision effectively becomes one of the individual people who are immunocompromised to have to basically fend for themselves while being constantly at risk. And kind of the point of masks was to protect each other, not necessarily for the person to not get the virus, but to not transmit it, to make it more difficult for someone to spread the virus, meaning that people who are immunocompromised might be put in situations where if they go out and continue their daily lives, their freedom might actually be restricted because they can't do it if people aren't wearing masks and protecting themselves. And that's something really frightening and worth considering. Now, the threat of mutation and the question of the immunocompromised gets exacerbated by the reality that many people have never worn masks. And the new CDC guidelines could, like I've said before, incentivize people to lie about getting the vaccine and to go without a mask, even though, they really shouldn't. There's no way to keep track of who's vaccinated and who's not. Yeah, we have vaccine cards, but is everybody going to carry that in their wallet? Is there going to be some sort of, protocol for that? There was a lot of talk about a vaccine passport, and that was completely, destroyed as an idea. So how do we manage that in terms of the safety of people going forward? Further, as there have already been reports in the news media out there, there's confusion about this new mandate, where people are conveniently hearing that masks are just no longer required for everybody, to the point where Dr. Fauci was even forced to respond, and, some states have actually begun to lift some of their restrictions without any sort of plan to determine if people are vaccinated or not, and some have just broadly just removed mask mandates entirely. So I want to take a look at that information. The Washington Post has the quotes from Dr. Fauci, where he states, "I think people are misinterpreting, thinking that there is a removal of mask mandate for everyone. It's not," he told Axios. "It's an assurance to those who are vaccinated that they can feel safe, be they outdoors or indoors." Fauci emphasized that the health agency did not explicitly tell unvaccinated people to go without masks, but instead communicated to vaccinated individuals that they will not get infected indoors or outdoors. And I'm sorry, that's not the information I read off the CDC website or those studies. That especially if you remove masks, yes, it's less likely that it will occur, but I think to say that people will not get infected is kind of an exaggeration, especially when most of the people being studied were, again, on people who were already social distancing, wearing masks, and got vaccinated. And that the combination of protection is probably going to make things better than just one form of protection in and of itself. So people either read them quickly or listen to and hear half of it. They are feeling that we're saying you don't need the mask anymore. That's not what the CDC said, he told the news outlet. And meanwhile, when we look at some of the reports from different states, from WebMD, as of May 18th, it had only been 5 days since the CDC had made the long-awaited change to its mask guidance, and 23 states and Washington, D.C. had already followed suit. And they have a list of all the different states changing their policies, but 27 states never enacted mask rules in the first place. But these are the states that did and now have adopted the CDC mask guidelines through certain counties, towns, and businesses still maybe enforcing their own rules. And you get places like Illinois where they are removing their mask mandate even though Chicago isn't. Kentucky's ending their mask mandate by June 11th. You get Massachusetts as of May 29th that they'll completely follow the CDC guidelines. And in Vermont, all restrictions are likely to end by July 4th, which of course in the United States there's going to be barbecues and gatherings on July 4th, meaning that it's just going to be a space where people who have not been vaccinated can spread things back to people who have been vaccinated. And even if these vaccines are as effective as they're saying, that still may cause people to get the virus and spread it to immunocompromised people in their lives. This is something that is going to cost lives. It may not be as many as before, but I think it's still something significant to look at when we're talking about the freedom, the discussion about freedom, about wearing a cloth on your face versus the freedom of people who are literally going to die or get sick or be hospitalized for a long period of time, given their own health and other issues that are involved, especially if mutations start to form. This just doesn't seem to me to be a valid risk that we should all be taking. Now, this effectively means that with the vaccine rates still low, the CDC may have really planned poorly on this. given that they release this information without giving people time to adjust or setting goals, especially long-term goals. And it just seemed like a sudden shift that's causing people to respond to it in the way they kind of want to hear it, as opposed to having a sort of de-escalation of things and guidelines that they could give to state governments and businesses over time. Which leaves us really one question left out of the ones that I originally asked. Is there a medical consensus with the CDC? So I want to take some time to look at certain perspectives that have gone against the CDC and see exactly what they're saying. So the LA Times put out a piece where it was quoting a bunch of tweets, actually, from doctors who were critical of the positions of the CDC. I strongly recommend to others that when at an indoor place where both vaccinated and unvaccinated people mix, like grocery stores, that they wear a mask too. So basically, if you're in any sort of venue where you can't control and make sure that people who are unvaccinated are not there, you probably should be wearing a mask, according to this doctor. Dr. Carlos Del Rio, infectious disease expert and executive associate dean at Emory School of Medicine in Atlanta. Dr. Ashish Jha, Dean of Brown University of Public Health, also said in a tweet, "Here's my personal practice for now. Continue indoor masking in public places like grocery stores until more are vaccinated and infection numbers are down." Add me to the list as well, said Dr. Kristen Bibbins Domingo, chair of the UC San Francisco Department of Epidemiology and Biostatistics. "Wearing my mask indoors just a while longer until the rates of vaccinated people are higher." Now, of course, that's just a small sample set and anecdotes, basically, of doctors that could be providing this information. However, there was a loosely done study and survey that determined that hundreds of epidemiologists had basically thought that people were going to wear masks for at least another year. In an informal survey, 80% of epidemiologists said that they thought Americans would need to wear masks in the public indoors places for at least another year. Just 5% said people would no longer need to wear masks indoors by this summer. In large crowds outdoors, like at a concert or protest, 88% of epidemiologists said it was necessary even for fully vaccinated people to wear masks. And I think that's something worth talking about, given that this study covered over 720 epidemiologists. Now, given the amount of scientists that are making this claim, the idea that in this sample size of 723 epidemiologists, that 80% are making this claim, that's going to have a very short variance in terms of the amount of percentage of people who believe this, even in such an informal study. Which means that there is some weight to this, and a lot of doctors do not provide consensus with the CDC guidelines. And that's people who study this type of thing. Now, the most telling to me was the response from National Nurses United, the largest nursing union in the United States. And the reason why I think their opinion is probably the most valid is they're the ones who are on the front lines dealing with the coronavirus, this entire pandemic. They are the ones who have seen the worst of it, and their own workplace conditions are affected by the policies of the CDC and the United States government. Meaning that if things are wrong, they not only have a self-interest in all of this, but a social interest in this to make sure that less people are infected. Their job and profession unites both of those in quite an effective way. So what did they end up coming out and saying? They said the newest CDC guidelines is not based in science, nor does it protect public health, and threatens the lives of patients, nurses, and other frontline workers across the country. The issues that they had with the new guidelines include the following: that the case rates are still high, that there are more transmittable, deadlier, and may already be vaccine-resistant variants that are out there. Nurses emphasize that this is that there are unclear questions about the vaccine, specifically with asymptomatic and mild COVID infections, and how well vaccines prevent transmission of the virus, as well as how long protection from the vaccines will last. If we shut down these type of mandates and it turns out in 6 months the vaccines are wearing off and everybody needs to get a booster, for example, then we really haven't served any good by having people remove their masks at this time. And it just seems to me that just based on those initial assumptions, these nurses were asking a lot of the same questions I was and kind of came to a lot of the same conclusions, especially about the science involved in all this. Now, one of the other issues they had is the issue that aerosol transmission and issues about ventilation, respiratory protection, and testing of asymptomatic cases were not being properly implemented. And that could honestly be covered in an entirely different video, especially when we start talking about opening schools in September and everything else. The CDC already put out information that we should not have people in a space consistently for a long period of time, even with vaccination. And so maybe that's something I'll cover later. I'm not sure. But with that said, the nurses are very much concerned about that particular component of things, especially in a hospital environment. Preventing and reducing transmission of COVID requires multiple layers of protective measures. Nurses say this includes masks, distancing, avoiding crowds, and large gatherings, in addition to the vaccines. And this is the point that I was really making earlier. There's no control in any of the studies that talks about whether or not it's just the vaccines or whether or not it's vaccine plus mask plus distancing plus all the other precautions that we've been taking as a society that creates these positive 90+% outcomes of effectiveness for the vaccine. As a matter of fact, if you remove one of these, you might see those numbers drop, you might not, but we don't know. And that's something that we should have really studied and tested for in some way, shape, or form before coming out and say that the vaccine could be, that those who are fully vaccinated, rather, by this vaccine could begin to start removing their mask mandates and stop wearing masks and stop social distancing and all the other precautions that we've taken. The rest of the guidelines will also, unfortunately, disproportionately harm Black, Indigenous, and people of color. And this is something that's been shown throughout the pandemic. There has been so much inequity in vaccine rollout and racial inequity in who is a frontline worker put at most risk by this guidance. If people start lying and they start going into grocery stores and doing these things, or even if they just misunderstood the policy of the CDC and stop wearing masks and they somehow get COVID and spread it into stores, who are the majority of people working in storefronts in a lot of cities? It's people of color. So they're being completely real about this, that the importance of the CDC guidance will actually disproportionately be affected by workers of color, their families, and their communities. And this also ends up for them personally violating certain positions about work safety that they are very much concerned about. So with all of this, the decision by the CDC does not appear to have a strong medical consensus. And quite to the contrary, it seems like it's been opposed by a large number of medical professionals. Both epidemiologists and nurses seem to be very much opposed to this particular policy. Many of them have, again, put out a lot of concerns that are similar to the ones that I outlined today, and we're asking very similar questions to the ones that I was asking. The research the CDC used to come to their decision does not seem to provide a definitive understanding that vaccines provide the same level of protection without masks. Further, the release of this new information seems to have created more confusion than anything else, as this decision came very suddenly and did not provide effective warnings for businesses, governments, or people to respond appropriately or have any sort of long-term plan. It may have also been an early decision that gave few people who are, fully vaccinated at this point, the ability to make their proper decisions, and it may lead to long-term issues such as mutations that could harm everyone, especially the immunocompromised. And at this point, while none of this that I'm providing can be or should be taken as medical advice, I really do think people should continue to wear masks, continue to practice some form of social distancing around groups that you cannot control for vaccinations with, And it should really be understood, at least from my perspective, that a lot of the CDC evidence has come off as insufficient and unpersuasive. At the very least, I know that even when I reach the point of being considered fully vaccinated, I will continue to wear my mask despite that. And I think that's the safest way to go. I don't see a downside to it. The mask has never really been an issue. And the idea that I might be able to make an environment slightly safer for immunocompromised people, even in such a short and small way, makes me feel like I'm, doing the right thing on that regard, but also for my own personal safety and for the people around me. It just seems to make a lot of sense. And I don't really understand why the CDC came out and made the decision that it did. It just doesn't seem to add up to me. And I'd love more information. I'd love to have them actually do the studies that I described where they actually control for certain things. But until that's done, I don't think it's a safe determining factor to declare that we can just get rid of the masks and the other forms of protections that we've had working for us in terms of protecting people at this point. So with that said, if you like this video, give it a thumbs up, hit the subscribe button and bell for notifications. You can follow me on Twitter and check out my Discord in the description down below. My name is Anarchist Tara, and I thank you for watching.